McKeever with Western Center on Law and Poverty. Actually, I'm happy to be here, even though it's a 3.5 hour drive or so from Sacramento. But any opportunity to get out of the state capitol building is one I like to take when I get a chance. So it's good to be in Fresno. Actually, it's also a city drive, and it's nice to go through the heartland of America and see legendary places like Madera, which those of us in legal services world know as probably the community with the most outrageous and illegal acts per capita, I think, of any place in the state of the country. But Fresno is especially important, and I really did want to be able to come here for a couple of reasons. One, this is the heartlands, and people here, I think, are both feeling the effects of a declining economy and what is going to happen to them as a result of it, and what a proposal like the governor is making will do in the context of a declining economy, and how people who perhaps even don't feel themselves personally jeopardized react to these kinds of issues. Because to the extent that people here in Fresno support or oppose the governor's proposals, I think will have, and the kind of view that they take of them will indicate, I think, to a great extent, what kinds of success we might have in trying to fight it. And secondly, you have among the most influential legislators in the state of California who represent parts of this area. And it's very important, I think, for us to address those of you here, because Ken Maddy, who's minority leader of the Republican Party of the Senate, and Bill Jones, who heads the Assembly Republican Party in the Assembly, and Jim Costa, who is the Democratic Caucus Chair in the Assembly, and Bruce Bronson, who chairs the Health Committee in the Assembly, all are major figures in the state capitol and state government, and how they respond to these kinds of issues is going to be very important when they are dealt with and decided over the next couple of months in the legislature. I think part of our task, as we'll talk about, is trying to minimize damage that happens in the next couple of months before we really face the crucial test, assuming there's going to be that in November with the initiative that's been proposed by the governor. So the subject for today is welfare. The W word, some people call it, I guess. It's interesting if you looked in the dictionary recently how surprised you might be to find how it is defined, but the state of being or doing well, condition of health, happiness, and comfort, well-being, prosperity sounds like a good thing. But those who have targeted it as something that is worthless and useless and that degrades people will find it to be something otherwise. The definition, I think, for our purposes is income assistance for people who are poor, basically. And the principal program that is the subject of most of the attacks, both in California and across the country, is known as Aid to Families with Dependent Children. Some of you, I'm sure, are quite familiar with it. AFDC is the acronym or the letters that describe it. In addition, also General Assistance, or GA, or General Relief, GR, is another program that is also the subject of the governor's initiative, and is also a program for largely single adults that is subject of attack around the country. Supplemental Security Income for age blind disabled is also a welfare program, but is not, because that population has been looked upon differently than the others, been quite the focus of attack, although we'll see that there will be some impacts that these proposals have on that population. But AFDC is really the focus of what the governor is aiming at. And it's important, I think, we understand the realities, because much of what is being promoted relies upon myths and assumptions that are simply untrue, that can be shown to be untrue, but which are very stereotypical and prejudicial, and we should recognize them for that. The image that is created by the governor and by those who promote this initiative is of a family receiving AFDC. By the way, of course, it's only for families with children. It is, by definition, a children's program. But generational families, usually black is the image of the family that's put forward. On aid for their entire lifetimes, large families, women having children to get more AFDC, no will to work, and happy to rely on the amount of money, supposedly quite generous according to the governor, that is paid through the agency program. So let's look at what the reality is. And the reality is something that we know, those of us who are advocates for the poor, from the experiences we have directly with the people we represent with, as well as what evidence there is. Both research, just data, statistical evidence. There's a lot of it on this population, on this area. And we know from it that virtually everything the governor says is wrong. Typical family is a mother, single mother, more commonly divorced or separated, but a single mother with 2 children, one of whom is preschool age, on a total time of maybe 2 to 3 years is the typical length of stay for a family on AFTC. More likely to be Anglo than of color, or at least than of Black or Hispanic or Asian. In the course of a month, maybe only 7 to 8% work, but over a period of 2 years, about half of AFTC parents work in some way, either part-time or for a short period during a 2-year period. The maximum amount a family can get in California, family 3, is $663 a month. That's 69% of the poverty line. Most families also qualify for food stamps, which is about $150, $160 more a month. So that's still, combining those two, 15% less than the federally established poverty line. In California, that amount, which is now 4th and highest in the nation for AFTC, after that last year's cut, we dropped below Vermont and Connecticut, in addition to Alaska. But Californians have to pay the highest housing costs in the country. 6 of the 10 most expensive rental markets are in California. They include San Francisco and Oakland and Orange County and Los Angeles. The fair market rent for a 2-bedroom apartment goes from about, in Fresno, $549 a month, up to San Francisco's $962 a month. That's the fair market rent established by the Department of Housing and Urban Development. That has to be paid for as soon as people can find housing at that cost out of the $663 a month. Now, of course, many people can't do it, and they have to use and find very substandard housing, move in with other people, live in very poor neighborhoods where their children may be unsafe. But it's not an easy life, and I think AFTC families and mothers can testify that it is not easy, and that it is not something that people look forward to doing their entire life. We also should have some international perspective on this, because I think when people are talking about welfare, there is this idea that we're so generous and that somehow also we're slipping internationally because we are so generous. But the United States does the poorest job of any of the other 7 Western industrialized nations to which it was compared in a recent study of bringing poor families out of poverty. Countries like West Germany and the United Kingdom and Sweden and Canada, all with transfer programs, with public assistance, move many more people out of poverty than does the United States. We're last among that group of countries. Now, what we're seeing today is an attack that is something new, but it's also something old. It's not that unique. Those of you who've been around for a few years in recent history will remember a repeated series of attacks on welfare. In the modern age, going back, I guess you can start most recently with Governor Reagan in California back in the late 60s, a whole series of quote-unquote welfare reform measures that were passed in California in 1971, federal level when Reagan became president in 1981, more reforms in 84, the federal level, 85 in California with the Greater Avenues for Independence Work Program, 88, the Family Support Act, all aimed at what was commonly perceived to be a problem of too many people on welfare. What do we do about it? And the more recent efforts tried to combine some sort of education training with a requirement that people participate in these programs. It's also interesting, and I won't go into this in any depth, but to look historically at the debates that have happened, not just in the last 25 years, but since the 16th century. And I commend to you, if you haven't yet looked at them, Piven and Clowers Regulating the Poor, or Michael Katz in the Shadow of the Poorhouse, to see how many of the same things that we're hearing from Governor Wilson now were repeated in the 16th century in France and England, in the 19th century in the poor laws in England, and in the United States in debates that have been continuous over the course of time since really market economies developed a need for some sort of public relief for people who the market economy simply didn't support. So we've now got nationally a whole set of proposals coming from various directions: Wisconsin, New Jersey, Maryland, different kinds of cuts that have been proposed, different kinds of conditions on aid. But I must say, having been to a conference in Washington recently with other people who are facing this, California is unique in a couple of ways. One, what is being proposed now is more extreme than is being proposed anywhere else in the country. There is no other state in which a serious proposal is being made for a 25% reduction in the amount that poor families receive. And secondly, I think we're talking about something beyond public policy in these debates in California. We're talking about what is, I think, unquestionably a political and electoral strategy that is less concerned with trying to do something that makes sense in terms of public policy and more concerned with the outcome of the November elections, who controls the state assembly, and whether or not the governor's power is enhanced enormously through increases in his ability to dictate the nature of the state budget, which is also part of the welfare initiative. I won't spend time on it, but it is an unprecedented increase in the governor's power of the budget and the virtual elimination of the legislature as a player in it. Let me go through quickly just what the proposals are that the governor's put forward and show why they are rooted in the myths that the governor is using to justify them. First, there's the grant cuts, 10% across the board. So the maximum 663 goes to 597 immediately for everybody. Then when you're on aid for 6 months, another 15%. So it goes down to 507 for a family of 3, a maximum amount that a family could get. This is supposed to be sort of a work incentive, a transitional grant the governor's talking about during the first 6 months. The assumption is, of course, that after 6 months, anyone could get a job and make up any loss or get off welfare or simply avoid the need for reliance on public assistance. And the idea sort of is that unemployment, involuntary unemployment, is an illusion and a myth, that anyone, no matter who they are, can just go out and find a job. It's purely a question of personal motivation and will, and not a question of the condition of the labor market, of barriers to work that exist in child care, employment and training, in depressed communities where opportunities don't exist. And the governor's notion of work incentives is that basically the incentive is that if you don't work, you starve. And he repeatedly talks about work incentives, but I think he has perverted the use of that word because no one is better off. Not one working poor family can improve its situation under the governor's proposal, although he talks repeatedly about work incentives. The best you can do is stay even. And many working poor families who will also use AFTC to supplement their wages, their low wages, half-time minimum wage workers, for example, lose money because the grants that they would get are also being cut. So nobody does any better. And you can only do worse. The family cap is a limit on the amount a family can receive if another child is born into it, and if the woman becomes pregnant while receiving aid. So no additional aid for another child if the child is conceived while she's on aid. The assumption here is that women have children for welfare. Lots of evidence that shows this is not true. The family sizes don't support this. If in fact that were true, women would be having many more children. The number of children on welfare has declined over the last 20 years. It used to be the average typical family had about 3 children, now it has 2. Studies of welfare mothers show that they are less interested in having children when they're on aid. than they are when they're not in others, than others who are not on welfare. Again, a myth, if we assume especially just sort of a rational approach to what a woman would think about, this is, we're talking $125 more a month to have a child, to care for a new baby. And that's not a rational calculation, and women don't make that calculation in any kind of serious, significant way. But it is an underlying assumption of the governor's proposals. The residency rule that has gotten a fair amount of media attention, that assumes that people move to California from out of state in order to get higher welfare benefits. As I said, California has the fourth highest benefits in the nation, but people don't make that calculation in any kind of serious way. Migration patterns tend to follow jobs and not welfare. Migration has been more out of the Northeast and into the Sunbelt states over the last 20 years. And Sunbelt states typically have lower AFDC benefits. California is something of an exception, but the migration has been out of the Northeast into areas where the AFDC grants are lower. And studies of the places of birth of AFDC children show that they're more likely to be born in California than our children generally. If migration for welfare was in fact a reality, you would see more AFDC children born out of state than is the case. The governor is also repealing all AFDC for pregnant women. They have had available to them a one-person granted a $7 a month supplement. They will no longer be eligible for that if the government gets its way. While Medi-Cal will still be available, still the kind of destitution that can come from not having any income support is not sound preventive public policy. Doesn't mean well for the fetus as it's growing, and will, I think, lead to serious problems for those women and those children born when the mother is absolutely destitute because there's been no income support. There are some other provisions of the government's initiative that I won't go into because I'm not sure that the time will allow. But virtually none of them can be defended seriously as legitimate public policy. The governor's people didn't really talk to people in education and people who run teen parent programs or any folks like that before they developed these. What's at stake here is that after redistricting, there are a lot more legislative races that are competitive, that are up for grabs. And what seems to happen fairly clearly is that the governor and Republicans have decided that as a way to take control of the state assembly, they will put this initiative out, force Democrats in local races to take what they believe would be unpopular positions on it, and use the welfare issue as an emotional wedge issue to beat up their opponents in November. So the people whose livelihood are at stake, children basically, 69% of AFDC recipients are children, are really pawns in this strategy. And they are pawns despite the fact that we know that if this passed, despite the administration's illusions about people somehow becoming employed, self-sufficient, no longer needing public aid if the amount available is just less, there will be direct and immediate costs. You can't reduce families' income by 25% and not expect that many families will be unable to meet basic necessities. In a few counties, they have actually looked at, using food stamp data, the costs of housing that families are actually paying now, and found that in Ventura, even 1,000 families will wind up with less under the governor's plan than they are currently paying in their housing costs. That's 1,000 families that are immediately at risk of being in the streets. And that's a very serious matter. And when asked about the rationale for these, what is striking is how little the administration has to say in defense of the underlying premises. In fact, the New York Times talked to an administration representative a couple of weeks ago and said, is there any reason to think that what you're proposing is going to do what you say? And she just said, I don't know. Well, that's a fairly serious lack of information and lack of knowledge to use as a basis to put forward something that we know can do serious damage to kids and families and poor people in the state. And we know that the impact can go beyond just homelessness, that destitution and homelessness will have major impacts on children as they're trying to go to school, as they're trying to learn, their stability in their ability to attend school, their access to health care, even though they may be Medi-Cal eligible, living in a more unstable environment without housing, moving from place to place is going to lessen their ability to have access to health care. The kind of housing that people, if they can avoid homelessness, will be in will be worse, overcrowded, rat-infested, and do serious damage to children as they're growing up and as they become the future generation of this state. Let me spend one moment on the question of work penalties, because I think this sort of reveals, again, further the cynicism that's being used in promoting this initiative. The governor talks a lot about how the welfare system is cruel because it penalizes work. There's actually one thing he says that's correct. It does contain penalties on work. What the governor doesn't explain is what those penalties are and where they came from. Because if he did, he'd have to take some personal responsibility of his own for them. The real work penalties that the governor cites were enacted back in 1981 for the most part. They were part of the Reagan changes that took effect when he became president, the Omnibus Budget Reconciliation Act of 1981. And they put limits on the amount people could earn and get a supplemental AFC payment. They limited the amount you could deduct for child care expenses to unrealistically low levels, but below the amount that people really need to pay for child care. The amount of work expenses that people can deduct before their earnings are deducted against their AFDC. A whole series of penalties on work. And the rationale back then, you may remember, was in defense of people known as the truly needy. The truly needy back then were those people who didn't work. They were thought to be the ones, according to Reagan, that were in need of most protection, and they could afford to reduce aid and to penalize those who did work. Well, these days, the rhetoric has flipped. Now the truly needy are unworthy. Now the working poor, the people who suffered the cuts back in '81, are looked upon as unfairly suffering because of this liberal welfare system. Well, it wasn't the liberal welfare system that created those penalties on work. Advocates for the poor fought them then, and they've tried to change them since. And in fact, they were part of the debates that occurred at the federal level in '84 and '88. Pete Wilson was in the Senate during those years. And there were proposals to change those and undo the work penalties. And Pete Wilson had nothing to say about them at the time. He did nothing to undo the penalties on work that he now decries as being so unfair and so revealing as to the failure of the welfare system. I think it just, again, reveals the hypocrisy and cynicism that's being used in promoting the initiative. One other, I think, fallacy that's being used is to attack those people who criticize this proposal as defenders of the status quo. And those of us who worked on poverty issues certainly shouldn't be described as defending the status quo. We fought work penalties. We tried to undo them. We tried to work for a whole series of things that address the question of poverty, because you can't define the issue as only welfare. Welfare didn't cause poverty, and you can't look to welfare to end it. Welfare is a safety net system when there are no other means of support for people, and it needs to perform that role, and it's an important one. But when wages are low, when unemployment is high, there will be a need for it. And when children need assistance, welfare is a social commitment to see that there's some minimal floor beneath which children who grew up in this state are not permitted to go. Let me just wind up here. There are lots of arguments that could be made about why lots of people should oppose this initiative. Seniors and disabled will lose cost of living for supplemental security income and in-home supportive services. Working poor people who are not on welfare will probably have to pay more of a share of cost before they can get Medi-Cal coverage. There's about 330,000 of those families now. As jobs are less stable, more people, and we're seeing that now, the caseload increases are coming with people who have traditionally not been welfare recipients, but have lost work and now have to turn to the system that is designed to cope with that. And the increase is much higher in what is known as the AFTC unemployed program. There's the two-parent household program is seeing an increase of like 25% each year. So a lot of people are on the edge and on the margin, and they have a stake in seeing that that these proposals are defeated because they can stand to lose. Even as crass an interest of landlords and small business people who will stand to lose money when the poor don't have it to spend. In fact, there's going to be $1 billion out of the state economy when AFTC is cut to the level that the government is proposing. And a lot of people who would otherwise receive that money aren't going to have it. And in a recession, to take money out of the pockets of poor people seems not to make much economic sense. But ultimately, I think, despite all those reasons, why broader ranges of people need to oppose this, I think we do have to come down to a certain ethical question. And it's a question of whether we care about each other, whether we're willing to support each other in times of distress, and whether we're willing to say that we have a commitment to see that there is some minimal level of decency in our society. I think there is a certain test that we face here. We actually faced that test in 1984 when Proposition 41, which was another extreme, ruthless assault on poor people, was on the ballot, and 63% voted no at that time. And I think we're facing that test again. And I think the governor has guessed wrong about the people of the state of California, because I think the indications are from history and from the polls that people are not willing to be as ruthless as he wants them to be. And my expectation is, and I hope that you will join in this, and that's why we're here today, that he can be shown that the people of California aren't as cynical and mean-spirited as he expects that we are.
I don't think I can be as brave as you. Can I move over to